Morning. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We are streaming live spine surgery today from our operating room on Thursday, November 20th, 2025. Our patient comes from Texas, and she's had pain in her neck going into her left arm for 10 years. 10 years of pain from her neck into her left arm. Now, she was offered more invasive type surgery in Texas, like fusion, artificial disc, but she did not want invasive spine surgery. She found out about the Deuk laser disc repair, which is a minimally invasive endoscopic spine surgery where we're not cutting your neck open. There's no soft tissue damage. There's no damage to bones, ligaments, tendons, muscles. Give me 1 second as I review the MRI. Stop. 2, 3, 4, 5, 6. Thank you, Jordan. So she has a herniated disc at C5-C6 with degenerative disc disease and a bone spur. Mostly herniated disc. It's on the left side and it's pinching on her left C6 nerve root. So just for your knowledge, if you have a C5-C6 disc herniation, it will typically pinch the C6 nerve root. If you have a C4-5 disc herniation, it will typically pinch the C5 nerve root. Nerve roots look like spaghetti, not angel hair pasta, but good old spaghetti. They're about that big, and they run from your spinal cord down into your muscles and skin, into your arm. And they are responsible for transmitting signals called electrical impulses, either from the brain down to the muscles or from the skin and receptors in the joints and muscle tendon organs up to the brain. Okay? So they're responsible for transmitting electrical signals. And she has the number C6 nerve root being pinched pretty badly and irritated badly. So there's two things. There's pinching and there's irritating. A lot of people don't understand. How many twitches does she have? Good. A lot of people don't understand that symptoms in the arm are due to two things. One is pinching, the other is irritation, chemical irritation. So what could be chemically irritating the nerve? The answer is inflammation. Inflammation is your body's chemicals being released by your inflammatory system. 2, 3, 4, 5, 6. So your inflammatory system releases these chemicals. Shot. And let's get an AP, quick. And these chemicals are released by cells called neutrophils. And the purpose of, that's good. The purpose of the neutrophils is to release toxic chemicals into your body to kill like bacteria and fungus. The problem is when your body attacks itself with inflammation. AP. And that's what's happening in her case. When you have a herniated disc, you have a tear in the annulus, and your body basically attacks itself. Your body's inflammatory system is attacking the herniation that's stuck within the annular tear. Shot? So Henry, let's show the audience how a herniated disc occurs and how it causes so much pain in the neck.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You can see from our video that when you have a traumatic injury to your spine, you can tear the back wall of the disc, and then the jelly from the center, which also gets damaged, will squeeze out the back. All right, we have a needle. Let's show the audience the spinal needle sitting in the middle of the disc. You've got the esophageal temperature probe in the esophagus. No, that's the trachea. There's the esophageal temperature probe. It's braided. And then you got the endotracheal tube, which is plastic, and it's inside the trachea. So this patient is fully asleep. She's chemically relaxed or paralyzed so that her muscles don't move. And the ventilator is breathing for her. So this is general endotracheal anesthesia. All right, we're ready to get started. We're going to start by doing a discogram. We want to see the disc tear in the back of the disc, and we want to see a herniation. Okay, so it looks like the dye is actually going, hold on, shot. There it is. It's leaking out through the front, back, and below. But there is a tear there. All right, we're going to get started. She has a pretty degenerated disc, and the dye is actually leaking out into the vertebral body below. But that's what happens when you have so much inflammation for so long, remember 10 years, that the inflammation, which is your body attacking the herniation, trying to get rid of it, it destroys the entire disc. And that's how degenerative disc disease happens. We're going to make a 4-millimeter incision in the front of her neck, and we're going to use a 4-millimeter tiny incision. This is the smallest incision that could ever be used to do spine surgery. This is the least invasive spine surgery in the world. And that 4-millimeter incision is what we're going to use to do the entire surgery. Any questions?
No current questions, so we do have a few comments, just sending prayers and love to this patient.
Oh, that's wonderful to hear. Let's go ahead and show the audience how we use the laser and endoscope to clean out the tear in the back of the disc so it can heal properly and get rid of the herniation and get rid of her neck pain and arm symptoms.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4-millimeter skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You can see from our video that we use a tiny 4-millimeter incision. This is a Band-Aid incision. There's no bleeding with this surgery. There's no hospitalization. There's been no complications to date in 20 years of performing the surgery. So it's the safest spine surgery in the world. It is also the most effective spine surgery in the world because we cure 99% of neck pain with this surgery that comes from the disc. We don't cure facet pain, we cure disc pain. Yes, and we're also going to get rid of the arm symptoms called radiculopathy. Radiculopathy is cured with this surgery as well. All right, you can count the vertebral bodies above: C2, 3, 4, 5, 6. So we're working on the C5-C6 disc. It's the disc located between the C5 and C6 bone. I'm advancing the dilator into the disc space. It's going to the back of the disc where the tear is. And that's actually where the herniation is as well. I always start from the side opposite of the arm, worst arm symptoms. Her worst arm symptoms are left. She has both arms with numbness, tingling, weakness, but we're going on her right side because we go across the back of the disc to the left. But we can get both sides with one incision. All right, the dilator is at the back of the disc. I need a little bit of inline traction. Let's do this on the count of 3. 1, 2, and 3. Oh yeah, I felt it advance. Just about a millimeter, but just a little more. Perfect, guys and gals. One more. Perfect. All right, you see that? So In the back of that disc, there's some dye still right in the herniation. That's a little dot of dye right there. Now we're going to bring our tube. Folks, the entire surgery will be done through a 4-millimeter tube. No open incision, no damage to her soft tissues, no bleeding internally, no need for narcotic painkillers after, because we're not tearing up the inside of her neck like ACDF and artificial discs do. The problem with invasive surgery is that it's extremely damaging to the patient's body internally, but you guys don't see it. All you see is a small incision, few inches long, but you don't know what the surgeon has done internally. They've destroyed everything inside just to do that fusion. You don't want a fusion or an artificial disc. All right, let's show the audience how the Deuk laser disc repair stacks up against other treatments that are being offered to people today. I need inline traction. I'm Dr. Ara Deuk-Majan, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk laser disc repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number one, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number one priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatments such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision that is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is, instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease, very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial discs. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial discs. Lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial discs, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive treatments such as epidural steroid injections. This is a treatment commonly recommended by pain management doctors. They stick a needle into your spine and inject the steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into the 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work, they're dangerous, they put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're gonna have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active and from getting more and more sedentary and developing deconditioning of your muscles because you're sitting around because you have neck pain all the time. Finally, let's talk about the Deuk laser disc repair. The Deuk laser disc repair is the solution for neck pain. If you have a herniated, bulging disc, extruded, ruptured disc, protruded disc, or degenerated disc, the Deuk laser disc repair works by minimally invasive treatment, going to the back of the disc where the problem is coming from. This is the tear in the back of the disc that has inflammation, and using a laser that is extremely precise. The laser fiber itself is 0.5 millimeter or half a millimeter wide, and the endoscope allows me to see 1/20th of a millimeter. I can directly see the nerves and spinal cord. It is an extremely safe treatment. As far as results go, the Deuk laser disc repair has the highest success rate of all the treatments we've discussed so far.
We have a 99% cure rate of neck pain coming from herniated discs, and the Deuk laser disc repair has 0 surgical complications to date. Our patients have an immediate recovery. In 1 hour, they're leaving our facility and they're going back to their hotel room. They usually drive themselves in the next morning for a quick checkup, and then it's back to a normal life. Well, I've enjoyed talking to you, and thanks for taking the time to listen to our video. I'm Dr. Ara Deuk-Majin. We'll also find this on our podcast, the Deuk Spine Institute podcast. Thank you.
All right, welcome back. You can see from our video why the Deuk laser disc repair is the best surgery for a herniated disc, degenerated disc, bulging disc in your neck. Folks, take a look at this. We are at C5-C6 in this patient. We've already cleaned out the other side, the right side, which had a lot of herniation. Now I'm on the left. This is the left neural foramen. I need to do a little more cleaning out, but look at all this scar tissue here. Tremendous amount of scar tissue in the back of the disc on this left side at C5-C6. Why? Because of that inflammation I was telling you about. When you get a herniated disc, it causes horrible inflammation in the back of your disc, and that's what the Deuk laser disc repair fixes. We're the only surgery in the world that cleans out the inflammation. By the way, these are bone spurs that I'm removing right here. See how easily the laser removes the bone spurs? There's some herniation right there sitting right on her nerve root. That's the C6 nerve root on the left side. That's the neural foramen. I have to take some more of this bone spur out right here. You don't want to take out any bone spur you don't need to. And we're operating right on top of the nerves and spinal cord. So this is very delicate. But the laser is the most delicate, most precise tool in medicine. And we use it every day at Deuk Spine Institute to cure people's neck pain, back pain, arm symptoms. Look at how precise that is. So for those of you who don't understand how small this is, I'm removing 1/20th of a millimeter of tissue with each blast of the laser. And the reason I can do that is because I'm using the endoscope to look at what I'm doing and watch what I'm doing. I'm using the endoscope. The endoscope is far better to use when you're fixing a herniated disc than a microscope or your own eyes or loops, which is what every other doctor does. Endoscopic surgery allows the surgeon to see and treat millimeter and sub-millimeter lesions, which is what you need to be doing when you're working around nerves. That makes this surgery the most advanced surgery in the world for treating herniated discs in the spine. Oh, look at that herniation right there. Massive. That's a big one. And look at it. It's getting calcified. It's scarred up. It's too big to fit out the tube. I'm going to try to grab it and pull it out. Otherwise, I'll have to chop it up with the laser so I can remove it in piecemeal. Any questions?
We just got a question from...
Oh, we got it. Look at this, folks. Check it out before you take the question. Look at that. We just got the herniation. Look at that.
You see?
Put it there. Put it there. There's the size. That's a 5 millimeter long. It looks like a little asteroid. We just pulled this herniation out. It was pushing on her nerve root on the left side. That was probably causing most of her arm symptoms in the left. By the way, check this out. Look at this is her neck. This is her chin. Her face is looking up. It's all covered. Her chest is here. We're on the right side. Look at the size of this incision, folks. 4 millimeters. Smallest surgical incision in medicine, right there. Anything smaller is just a needle. And by the way, look at the blood loss. We lost 2 drops of blood the whole surgery. We're almost done. This is why this surgery is so amazing. It works. Patients recover immediately, and there's no bleeding and no need for narcotics, no need for hospital. And yet, all these surgeons are still recommending invasive spine surgery. They shouldn't be. They should be referring their patients to Deuk Spine Institute so we can fix them properly when they have a herniated disc. Here's another piece of herniation right there. See that coming out? Goodbye. Say bye-bye to the herniation. It's leaving forever. All right, any questions?
Yes, we have a question from Aaron on YouTube.
Before we take Aaron's question, I just want to say this patient traveled from West Texas with her husband, and they found Deuk Spine on YouTube, on the internet, and decided to have us come fix their neck the right way, the safest, most effective way possible. She's also a breeder of dogs. She breeds Frenchies. I can't tell you anything more. I don't want to give away her identity, but she is loves her dogs, and she has beautiful dogs. So if you're in the market for a French bulldog, maybe you know who she is and her husband are, because they breed beautiful animals. So I've seen them, seen the animals. All right, there's the foramen. It's nice and clean. We've gotten rid of all the herniation. I got to go back to the other side. I'll take Aaron's question and any other questions you guys have, but type them up quick because we're almost done.
Aaron from YouTube asking, what percentage of disc herniation shrink on its own? After some part of the disc is removed, it will reduce its mass. Right then it will damage other healthy discs or not?
Aaron, great question. So what I see a lot of on the internet, which is misinformation, it's wrong, is there seems to be businesses that are promoting the idea with advertising that if you have a herniated disc, you can do whatever they tell you to do, and your disc herniation will shrink down on its own. That never happens. Herniated discs never, ever, ever go away on their own. They have to be removed. The only thing that happens is your symptoms will get better on their own, because the inflammation associated with the herniation will die down after a few weeks. That's why a lot of chiropractors make their living treating patients with herniated discs, because the chiropractors aren't really doing anything, I hate to say it, but they're just waiting for the inflammation to die down on its own, which it will. That is the natural history. And then when it doesn't, then they send you to the surgeon for surgery. All right? But the fact of the matter is, you don't need to wait. You don't need to do chiropractic for a herniated disc because it won't work. Just come to Deuk Spine. We can fix it in 1 hour, and you'll be very happy with the results. Because we're treating the source of pain, which is the inflammation from the herniation in the back of the disc, stuck right here in this crack. I've just removed some more bone spurs, and we're done. But you can see bone spurs like this take years to develop, and this has been going on for 10 years for this patient. There's no more herniation left. We're done. All right, any other questions?
Yes, we have one more question from Summer on YouTube.
Hello, Summer. Welcome to our stream.
Asking, what's the fluffy stuff being sucked away?
Those are, the fluffy stuff are pieces of herniated nucleus pulposus. That is the herniation. It's just that they're not calcified, but they're collagenized from all the inflammation creating scar tissue around the herniation. It kind of gets inside the herniation and makes it thick and hard, like cheese, like a hard cheese. Normally the herniation is super soft and fluffy, but after the inflammation's been going on for so long, it gets kind of hard. We call it collagenized. Folks, look at the size of this incision. No more fusions, no more artificial discs are necessary. We've been doing this surgery at Deuk Spine here in Florida for 20 years. We've had 0 complications. No narcotics are needed afterwards because our patients have no pain. They literally leave the surgery center without any pain meds. They take a Tylenol maybe at night, and that's it. And by the way, no bleeding. Here's 2 drops of blood for the whole surgery. This is bloodless surgery, painless surgery, immediate return to normal activities. And there it is right there. Look at that incision. It looks like a vampire with a broken tooth bit her neck. It's so tiny. You guys see that? It's amazing.
Yes, we do.
We do this every week. We've been doing it for 20 years. Our results are 99% cure of neck pain and back pain. Have a nice day. We'll be back shortly with another patient for a lumbar Deuk laser disc repair. She's got back pain and leg pain.
Dr. Deuk Machen here at the Deuk Spine Institute with a patient who traveled here from Colorado with her husband, and she underwent the cervical Deuk laser disc repair for 2 herniated discs in her neck. And how are you feeling today?
Great. Even on the way home, I felt all the pain released from my arms and my shoulders. I didn't realize how much pain I was actually in. So my arms just feel light. And sitting in the waiting room here earlier, I realized my neck is not hurting at all and my headache is gone.
So your headaches are gone, your neck pain's gone, and your arms are starting to feel normal again.
Yep. Yes.
Amazing, isn't it?
Yes. So amazing. I'm so grateful.
Yeah. Tell me what life was like for you before you came to Deuk Spine Institute.
We have 4 small children and it was very hard because we homeschool. My oldest started taking over laundry. I couldn't get in to the washer to get the clothes out. He has to help a lot with the little ones with school. I was in bed a lot with pain and laying down hurt. So then I would sit up in the recliner and I wasn't sleeping at all. Last night I slept.
Congratulations. Now, are you feeling good here today because we gave you lots of pain medicines, or are you on any pain med at all?
No, I didn't even take ibuprofen. I think in the IV there was Tylenol. I didn't even take the muscle relaxer, no pain meds.
Yeah, the pain meds from surgery wore off yesterday.
Yeah.
And today your body has no pain meds and you have no pain.
No pain.
Congratulations.
Thank you.
Now, it must be hard with such a severe, debilitating neck and pain and headaches when you have kids because, you know, your whole life is all about having kids and bringing them up and engaging with them and being part of their life. And when you have pain like that, it takes your time away from your kids. It takes your quality of life away. So you had to do something about this.
Yeah.
And did you have any treatment in Colorado?
They wanted me to do an epidural in the neck because there was no room in the spinal cord. That made it worse because the fluid had nowhere to go. So I did that, and then the surgeon in Colorado wanted me to do a fusion and basically laughed when I asked if there was other options. So that's when it led us to do more research and watch all of his videos and know, I just knew in my gut this is where we had to come.
Yeah, you're right. I'm glad you did not choose the fusion, but why did you not choose the fusion? What were you worried about?
I was worried that I have 4 young children, and if I do a fusion, it would be worse, and then it would just keep continuing all the next discs. And I was really having like a claustrophobic feeling of I won't have any movement. I'll lose my mobility if I do a fusion.
And with the Deuk laser disc repair, you can see we went in with a 4mm incision. There was no bleeding. There was no hospitalization. She was asleep for an hour while we did her procedure, and you basically woke up pain-free.
Yes, I was actually very emotional when I woke up because I was like, our whole family needs to come here. All of our parents are in pain, so this is where you need to come.
We'll take good care of them here. Well, share with the audience watching what life is going to be like for you now and anything you want to tell the audience.
I feel like when you're in chronic pain for so long, you start to have anxiety, have maybe a little bit of depression, and all of that has completely lifted. And I think doctors will be like, oh, you're just depressed, take this medicine. But that's not what it is. It's the pain, the chronic pain. So I know that my quality of life will be much better now. My 2 boys play hockey, and there were so many times I couldn't sit in the stands. So it's really exciting.
Congratulations.
So, yeah.
All right. Well,
Thank
enjoy your
you.
life with your family.
Yes, thank
All right.
you.
Let's get